Respiratory.
Hi.
Hi, Mrs. Pribble. How are you today?
Good, how are you?
Good. I'm Tori with Respiratory Care, and I'm here to help you with some treatments today. Is that okay?
Sounds perfect.
All right. Could you verify your name and birth date for me today?
Miranda Jean Pribble, 8/24/94.
Okay. All right. So I'm going to be helping you with respiratory care treatments today. Is that something you've ever done before?
No.
In the past? Okay. So I'm going to just go ahead and instruct you on what these medications are for and how to use them, okay?
Perfect.
All right. Before we get started with our treatment, I just need to take a quick listen to your breath sounds. So if I could have you sit up nice and tall and just take some nice deep breaths for me in and out. Okay. And then I just also need to go ahead and get your vitals here quick before we get started. Alright, Ms. Purple, so today it looks like your doctor has ordered for you levalbuterol, aclinium bromide, and Symbicort. So those are each in different type of inhalers, so I'm going to show you how to use those today. The first thing we're going to start with is the levalbuterol, and we're going to take that in a small volume nebulizer. And that's something that we're going to take every 4 hours, and it's used to help open up those airways. Okay? So this is what a small volume nebulizer looks like. And so the first thing you need to do is just go ahead and put the medication in. You can put it in right through here on the top. It's one of the easiest ways. And then you just need to make sure that it's plugged into the air compressor as well as the electricity. Okay. When you turn it on, you're going to see a mist coming out of the ends, and you're going to just go ahead and breathe normally. Every 3 to 5 breaths, you'll just take a nice deep breath in, and then continue with normal breathing. And then when it starts to kind of sputter, you'll hear that sound, and then you know that it's done. Okay. So to use this, you're just going to go ahead and wrap your lips around the mouthpiece and breathe normally with that deep breath every few. Okay. All right. We'll just go ahead and do that. Very good. And just every few, just that nice deep breath and get it deep down in those lungs for you. Great. All right. Very good. Thank you. Can you go ahead and take a deep breath and then cough for me? Alright, very good. Okay, so the next treatment that we're going to take today is the aclinium bromide, which is a dry powder inhaler. We're going to take this once daily. And to use a dry powder inhaler, you will open the protective covering here, and you're going to wrap your lips firmly around the mouthpiece. Before you do so, you need to turn your head to the side and take a really deep breath out, as far out as you can. When you're ready to breathe in, you'll wrap your lips around the mouthpiece, take that deep breath in, hold it for about 10 seconds or as long as you can there, and then when you exhale, you'll exhale to the side as well. That way we're not clumping up any of the medication inside the device. And then right here you're going to see that there's a dose counter on the front. That lets you know how many doses you have left before you need to refill it. Okay. So go ahead and take that now. Go ahead and take that deep breath out to the side. Very good. Wrap those lips around there and take a deep breath in. Alright, and hold that as long as you can, about 10 seconds, and perfect. And go ahead and exhale to the side. Very good. Alright, and can I have you take a deep breath in and cough for me? Okay, super. Then the last medication that we're going to take today is Symbicort. And Symbicort's a corticosteroid, where the other two that we were taking were bronchodilators. Albuterol is more short-acting, and then the aclinium bromide is going to last longer. And so that's why we're taking both of those. Now, this is a corticosteroid, so this is going to actually help reduce the inflammation in the airways. So to use one of these devices, it's called a meter dose inhaler. We're going to shake it up really well. Okay, and then if it's been a while since you've taken it, you just need to take the lid off here and discharge one dose into the air. That way you know you're getting the full dose. Okay. So when you're ready, you go ahead and shake it up, take the mouthpiece off, you'll wrap your lips securely around the mouthpiece, and then you're going to simultaneously push on the canister and inhale deeply, hold for 10 seconds, and then you can exhale. Now on the Symbicort, we're taking 2 puffs, so we need to go ahead and take 1 puff, Wait about 30 seconds and then repeat the process to take the second puff, okay?
Okay.
Okay, so we'll go ahead and do that now. Just wait a little bit, go ahead and shake it again. There you go, perfect. All right, very good. Can I have you take a deep breath in and cough for me? Okay. So with corticosteroids, whenever you take those, it's really important that you rinse your mouth out. So go ahead and rinse that out and spit. That's going to prevent any thrush from building up inside of your mouth. Great. All right. And I'm just going to take another quick listen here to your breath sounds. If I can have you sit up nice and tall for me. And just go ahead and breathe deeply. And I'll go ahead and get your vitals here one more time. All right. Ms. Purple, do you have any questions for me today about the treatment that you received?
Not right now.
Okay. If you do later on have questions, please feel free to call and we can clarify any questions you might have.
Perfect.
Here's your call light for you.
Thank you.
Okay, and I'll see you again in about 4 hours for another levobuterol treatment, okay?
Okay,
All right,
perfect.
thank you.